Susan, I notice your A1C is going up. Tell me how you feel about managing your diabetes.
Some days I just want to pretend like I don't have diabetes.
Having diabetes is like juggling balls in the air all day, every day. Monitoring your blood sugar, taking medications, dosing insulin, planning meals, and staying on top of your family and job responsibilities. That is a lot. Diabetes is hard work. And Susan, you have a lot to do. So tell me more about how you pretend not to have diabetes.
Well, I don't check my blood sugar very often. Sometimes I don't take my insulin, and I do eat whatever I want.
So some days you don't check your blood sugar and you don't take your medication. How does doing those things help?
It doesn't. I feel guilty, and my family stays on me about taking care of myself.
Do you mind if I share some information with you about diabetes distress? Diabetes can affect you physically and emotionally. Living with it every day can make you feel discouraged, stressed, or even depressed. The way you deal with your emotional lows is called coping. Sometimes you may feel tired of doing all the things required to take care of your diabetes. This is called diabetes burnout or diabetes distress. Some signs of diabetes distress to look for are if you feel angry or have resentment about your diabetes care. Do you feel overwhelmed about facing your day? Do you forget your medication or to check your blood sugar? Do you have a lack of motivation or energy?
Yeah, that sounds like me, but what do I do about it?
Well, first remember that stress is a natural part of life. Learning how to best deal with the feelings it can cause and getting the support you need is what's important. And second, no one expects you to be perfect.
Well, that's good, but where do I start?
Well, what has helped you handle stressful things in your past?
Talking to my best friend, maybe going for a walk by myself.
Well, great. Those are both great ways to reduce stress. Would you like to try an exercise that might help you decide where to start?
Sure, why not?
Okay. Start by naming 3 emotions that you feel when you think about your diabetes. Anger, fear. What's the first thing that comes to mind?
I'm worried that my diabetes is getting worse. I'm anxious and probably angry.
Next, think about who would be a good support when you feel this way. This could be friends, family, clergy, or a diabetes support group, or even your pet. Now, name 3 activities that will help you work through this emotion and feel better. Susan already named 2, talking to her best friend and taking a walk. But there are lots of things that might help. What do you do to relax?
Being able to pinpoint that I'm feeling worried helps. Looking at different ways to handle my stress could be what I need.
Well, good. I'm glad. Most people do best if they work on one thing at a time. So what would you like to work on?
I think taking my medication is going to be the most important.
Well, what prevents you from taking your medication?
Sometimes I just leave it at home so I don't have to take it.
What can we do to prevent that from happening?
Could leave some at work or maybe put it in my purse.
Well, that's a great idea, Susan. Now you have a good plan. Diabetes is not easy. If you think you're experiencing diabetes distress, you may need to ask for help and talk with a mental health professional. If you have a sadness that doesn't go away or you just feel hopelessness, it may be depression, not diabetes distress. The symptoms of depression include withdrawing and feeling a sense of hopelessness and helplessness. Depression needs professional medical treatment. So please contact your healthcare provider. But remember that diabetes is a treatable condition and don't be afraid to ask for help. When you feel down, think about your successes and feel good about your progress.